Welcome, everyone. I'm Dr. Carr, and I'm just thrilled to guide today's conversation on practical strategies for liver health. I'm the division head of gastroenterology at the University of Washington and co founder of the Association of Black Gastroenterologists and Hepatologists, or ABGH for short. We are co sponsoring this event with Global Liver Institute. ABGH exists to promote health equity in Black communities, advance science, and develop the careers of Black gastroenterologists, hepatologists, and scientists. Today, we'll hear from a dynamic group of experts, two hepatologists, a nutritionist, and an obesity medicine gastroenterologist, as we explore what you should and should not eat and drink for better liver outcomes. Today's session will be packed with real-world advice from our expert panel on how to take better care of your liver. And we're going to start in your kitchen. So first we have Dr. Julius Wilder, who is an associate professor of medicine practicing in gastroenterology and hepatology at Duke School of Medicine. He serves as vice chair of culture, engagement, and community for the Department of Medicine at Duke, and is the public policy chair of the American Association for the Study of Liver Diseases, or AASLD. Dr. Andrea Reed is the Director of Diversity and Faculty Development at Mass General Brigham Gastroenterology. She's the Associate Dean for Student and Multicultural Affairs, the Director of the Office of Recruitment of Multicultural Affairs at Harvard Medical School, and a hepatologist who has a special interest in a liver disease you'll hear a little bit more about today, metabolic dysfunction associated steatotic liver disease, or MASLD, M-A-S-L-D. She also has an interest in access to liver transplant. Dr. Pickett Blakely is an associate professor of clinical medicine in the Division of Gastroenterology and Hepatology at the University of Pennsylvania Perelman School of Medicine. She's also the director of the Penn Center for Gastrointestinal Nutrition. Dr. Pickett Blakely is a practicing gastroenterologist, educator, and clinical researcher who has expertise in gastrointestinal and liver disease-related nutrition and gastrointestinal complications of obesity. And finally, we have Mrs. Jasmine Burrows, who is a registered dietitian and owner of Food That Fits You. Mrs. Burrows empowers communities of color to reclaim their health through a plant-forward, culturally inclusive, and holistic approach to eating. Her private practice blends evidence-based nutrition with real-life strategies that honor heritage, promote healing, and fit each individual's unique lifestyle. Welcome so much to all of you. I'm so excited that you're here with us. First, we're going to set the stage, and Dr. Reed, I'm going to start with you because there are probably people who are watching who had no idea before this moment that the liver is actually involved in digestive health. So what does the liver actually do with the food that we eat? And if you can talk about its role in digestion and metabolism, that would be great.
Wonderful. Well, thank you so much for having me. Yes, many people don't know how important the liver is with digestion. The liver processes food by absorbing the nutrients that are brought to it from the blood vessels and then utilizing them in various ways. But that's not all it does. It also processes our toxins and gets rid of them, and it creates a store of energy for us when we need it. So, to break it down a little bit, when you eat, food is broken down in your stomach and absorbed predominantly in your small intestine, or also known as the small bowel. And then those very small molecules are absorbed into the bloodstream and then make their way to the liver through something called the portal vein. When it gets to the liver, depending upon what kind of nutrient is, the liver decides what it's going to do with it. So one of the ones that it processes is carbohydrates, and carbohydrates are absorbed into the liver, brought to the liver in the form of glucose, sugar, a form of sugar. And what it does is it either stores it in the form of a storage molecule called glycogen. It can break it down. It can utilize it and put it back into the bloodstream as a form of energy. But it also can, when you're starving, the liver can actually create sugar so that it goes out into the bloodstream to feed your body when you're starving or fasting, those kinds of things. So it's very important in the way that it metabolizes sugar, the way that it stores it, the way that it puts it out into the body so that it can be utilized. But it also works on proteins, and proteins are an incredible source of energy. Proteins, again, broken down in the small intestine, but those molecules are not glucose, they're called amino acids. And those amino acids come to the liver the same way that the sugar does. And then it comes into the liver and it's converted into energy. It can be converted into sugar and it can be converted into fat. Now, when it breaks down these amino acids, there are toxins that come from the breakdown of these protein molecules. And one of those toxins, which people know more about than others, is called ammonia. And the liver actually helps us to convert that into something that's not toxic to get rid of that. And I'll get to that part of the liver in just a moment. The liver also helps us to process fats. And so the liver makes something called bile. It absorbs the cholesterol, again, from the bloodstream in these smaller forms, absorbs it, travels up to the liver, and the liver stores the fat in one form. It can break it down again for energy. It's a recurrent theme. And it can convert it also into another form of energy called ketones that we can use, especially when we're in areas where we're not well fed, like in starvation or fasting. The liver does a lot of really important things as well in terms of filtering toxins. And I mentioned that before, that it detoxifies the blood. And what people might not realize is that our bodies are always making toxins. It's not just from the things that we drink that might not be so healthy, which we'll talk about. It's not just from medications, drugs, other things. We actually have toxins that are developed just from the fact that food has to be broken down and transported through the body to serve as energy. And those toxins, they can be, problematic if the liver doesn't work to convert them into a non-toxic substance that can then be eliminated, often through the kidneys. So the liver is both the energy powerhouse, it's the largest solid organ in the body. It regulates our blood sugars, it regulates our cholesterol, it filters the toxins that come about because of what we eat and drink. Again, toxins are normal, but they have to be converted, and it helps to get rid of them. And it also creates a store of energy that can then be utilized at times when we aren't eating or we need energy for other things. So it both stores them, creates them, releases them when it's needed. It's a fascinating organ. That's why I spend most of my time working on it.
It is very fascinating. The liver has hundreds of jobs, and those are, just but a few. But I do find that people are very surprised when, as hepatologists, we're in the field of gastroenterology, and they say, well, why are you in gastroenterology? And that's exactly right, Dr. Reed, that the liver has a big role in digestion and metabolism. So thanks for setting the stage for all of our viewers here today. Dr. Wilder, I'm going to move on to you. What happens when the liver is overloaded, say with excess sugar or excess fat? And if you can also talk about maybe some of the big categories of foods or drinks that are most harmful to the liver.
Yeah, absolutely. What we eat is so important to our overall health. And I think many of us understand that. And because of the role that the liver plays in terms of managing what we eat, and as Dr. Reed just explained, breaking down those substances so we can use them in our body for energy, it becomes sort of an interesting story around how we eat really can significantly directly impact the liver as it tries to manage all these various things that we eat, how that can actually infect or impact that organ directly. For example, when we talk about what we eat, if you're eating a lot of foods that are, very fatty, foods that are a lot of like a high sugar content, excessive carbs like potato chips and bread. When we think about fatty foods, we think about things like McDonald's, we think of things like Burger King, fast food, and certainly any highly processed foods. All these foods can have a direct impact on your health in many ways. And one of the direct ways to impact your health is what they do directly to the liver. When you're eating those kinds of foods, you can actually have a buildup in the liver of fat. And that fat in the liver often can lead to something called inflammation in the liver. And inflammation in the liver is always a problem because when you have inflammation in the liver, that inflammation over time can lead to increasing scar in the liver. And so when we talk about liver health, we're really talking about what are things that potentially can hurt your liver. And then over time, how much scar can occur in the liver as a result of those insults. In this case, the things that you eat. And fat in the liver, in some people, can be associated with that inflammation. And the longer that inflammation is present, the more likely you are to develop scar. And the worse that scar gets over time, the more unhealthy your liver gets. And in some people, it can get to an extent where you can begin to have liver failure. Now, it's very scary because the liver is not like your heart. You know, a lot of times when people have issues with their heart, they often have symptoms pretty quickly, and you talk about heart attacks and the chest pain and those kinds of things. But the liver doesn't really work like that. And so, if you're eating an unhealthy diet, again, lots of fat, fatty foods, and sugary foods, and you are accumulating this fat in your liver, and you're getting more and more scar in your liver because of that fat, it could happen and you not even know it. And that silent process over time can often go on without your knowledge until one day you develop symptoms of advanced liver disease. And that's when you begin to see people who are very confused. They may have bleeding, they may have very bad swelling. And all this is a result of not because you drank a bunch of alcohol necessarily, although that can play a role. It's not because of, something you did per se, other than just eating in and of itself. And the key thing about this as well is that when we're talking about fat in the liver, it's not just what you eat, but there are lots of other metabolic factors that are important to consider. People who have diabetes, people who have high blood pressure, people who have high cholesterol, regardless of necessarily what you're eating, can be at risk of having increased issues with fat in your liver. And so over time, that scarring can lead to worsening health outcomes, particularly around your liver, because of your diet and the accumulation of that fat and that inflammation. And things like those sugary foods and fatty foods are often a direct result of it. Now, when we think about this and we define this, we talk about something called, you may have heard it in the past, called fatty liver disease. But because we better understand the total processes and the entities that come into play with this, we call it metabolic associated steatotic liver disease. And that's just having the presence of fat in your liver. But remember, I said that fat can have inflammation sometimes. And so if you get inflammation with that, it goes from just being the metabolic associated steatotic liver disease or MASLD, it can progress to MASH, right? That's the metabolic associated steatotic hepatitis. And that inflammation that comes with that is what's going to drive, okay, the progression of that scar in your liver and ultimately lead to complications in terms of your overall liver health.
Well, that's a mouthful, Dr. Wilder. And I think it's so important that we spend some time on this because a lot of folks don't know that they can get liver disease from eating an unhealthy diet, right? You mentioned alcohol, and we're going to get to that in a second. Most people know that you can get liver disease from alcohol, but most people don't know that diet has a big part to play in one of the most common liver diseases we see now, which is metabolic dysfunction associated steatotic liver disease. So thank you for explaining that to our viewers. This is a very preventable and manageable condition should someone develop it, really with some of the dietary things we're going to be talking about today. Now you brought up alcohol, and so I know that our viewers or some of them are probably wondering about that question. So I do want to spend some time on that as well. We do need to have an honest conversation about this, and I find that my own patients often tiptoe around this. They don't really know how to ask me, okay, how much can I drink? Can I drink? What's going to happen to my liver if I drink? So Dr. Reed, I'm going to toss this back to you. What is the real risk of alcohol? How much is considered too much for the liver, and is there even a safe amount?
Oh, well, thank you. And yes, this is a huge topic. I think we all spend a lot of time talking about this in clinic. A lot of people think that liver disease, if somebody has advanced liver disease, it's always due to alcohol, and that's not the case. But what is the case is that we're seeing a really dramatic rise in alcohol-related liver disease over the last several years, and especially since and including in and since the pandemic.
Mhm.
And it's not just because people started to drink more, although they did, especially and even in women, there's been a dramatic increase in the number of people that drink regularly and the amount that they're drinking, as well as binge drinking. And so the combination of the alcohol becoming so much more easily available, a lot of stress during the pandemic, all of those things probably led to increased alcohol intake. But actually, it hasn't gone down since the pandemic. So I think we're in a very, very important time to talk about how damaging alcohol, in fact, can be. So the most important thing to remember is that alcohol is absorbed, much as I was talking about the nutrients and how they're absorbed, alcohol is absorbed the same way. It's absorbed in the stomach and in the small intestine, and 90 to 95% of that is going to get processed through your liver. And just as I was talking about toxins, alcohol is a toxin. It's a legal toxin that goes into the liver, and it has to be broken down. And the liver includes these enzymes that allow the alcohol to be broken down into increasingly less toxic metabolites. But if you overwhelm the amount of enzyme that you have with the amount of alcohol that's coming in, this can lead to more and more, as Dr. Wilder was talking about, more and more fatty liver caused by alcohol this time, or inflammation. And the really important thing to remember that is that alcohol, people say, well, I only drink beer. Alcohol is alcohol is alcohol. So that to the liver, one 12-ounce can of alcohol is the same in terms of content as 5 ounces of wine, which is the same as a 1.5-ounce shot or spirit. So when you think about it over time, the liver is seeing with all those drinks about 14 grams or so of alcohol, and that can become toxic. So then what is a safe amount of alcohol? Again, one drink is about 14 grams. And what is considered to be safe? Nothing's 100% safe because it all has to be detoxified by the liver. But in general, low risk alcohol intake is a drink or less in women per day and no more than 7 a week, and no more than 2 drinks a day by men, no more than 14 drinks a week. Now that you could say, well, that's low risk. Well, what's high risk? Much more than that, especially if you have an underlying liver disease. So especially if you have other conditions, putting alcohol on top of it, even a small amount, may make your liver have to work harder to detoxify the alcohol and lead to liver disease. So as I said, we're seeing a rise in young adults, we're seeing a rise in women. There's been multiple studies to show that this is not abating. And part of this is why are women at greater risk is because women are smaller, they have less body fat, less body water, so that the same drink in a woman and a man will have different blood alcohol content because it's being distributed across a smaller amount of water. So women are particularly at risk from alcohol, and there's really no absolutely safe amount, but no women should be drinking more than 1 drink a day.
Yeah. And by the way, for those who are watching, that doesn't mean, so you mentioned what, 14 drinks in a week, Dr. Reed, for males, that doesn't mean, 2 days of drinking 14 drinks, right? You're talking about spacing it over time and not binge
Right.
drinking either, right?
Right. Well, I should have included that. Thank you for highlighting the fact that binge drinking is high risk alcohol behavior in all circumstances. Even if you drink nothing in between, binge drinking is considered to be 4 to 5 or more alcoholic drinks in a short period of time. It is always unsafe and very risky.
And we also learned this year that cancer can be caused by alcohol. So alcohol is now labeled a carcinogen. So I agree with you. There's no safe amount of alcohol, but there are ways that we can certainly modify intake to lower levels to at least reduce the risk to our health. So thanks for explaining that. Dr. Wilder, back to you, because you talked about MASLD and how that's related more to metabolism and diet. And now we're hearing about alcohol and how it can cause liver disease. What if someone has both risks? Can they get both things? And what are we concerned about if they have both risks?
No, absolutely. As we've come to understand more about these two separate entities, MASLD and the impact of fat in the liver and how that can lead to problems with your liver. And of course, we've known for a long time that alcohol has a direct impact in terms of negative impact on the liver. We really are beginning to see the combination of the two. And so while individually they are both very, very bad for your liver, in combination, they are even worse. And it's more than just double when we think about the true impact that it has with respect to that additive effect. The fatty liver disease, as I mentioned earlier, can lead directly to inflammation in the liver, right, and accumulation of scar over time. Alcohol, as Dr. Reed was alluding to, can directly lead to inflammation in the liver, and over time itself lead to progression of scarring in the liver as well. Alcohol also can lead to changes within the liver tissue, making it become more fatty, therefore creating this vicious cycle in combination with fatty liver disease to the progression of the production of fatty tissue and associated inflammation, and then progression of that scar. And so in these individuals, we not only see that they are more likely to have inflammation, but they're more likely to progress faster in terms of how quickly they get advanced scar and advanced end-stage liver disease. They are more likely to have issues with liver cancer and have much more serious complications in that setting. And so, as Dr. Reed and Dr. Carlucci, if you are an individual who has any underlying liver disease at all, we know for certain you should not really be drinking alcohol at all. There really is no safe amount of alcohol to be drinking. The scary thing about MASLD is that there are a lot of individuals who don't even know they have MASLD who are also drinking alcohol, and therefore they're having these two factors come together to drive this inflammation and progressive scar in the liver. As liver doctors, an important thing that we always have to do is to make sure when evaluating patients with MASLD that we understand, there is the risk from the metabolic factors that we know, that can contribute to MASLD. But we have to make sure that we sort of, understand, is there a factor or role for alcohol as well as we think about how we navigate and manage individuals with metabolic dysfunction associated with steatotic liver disease. And so there is no safe amount of alcohol, especially if you're an individual with any kind of liver disease, but especially if you're an individual who has MASLD. And one of the things that I always recommend my patients in this setting is to just avoid alcohol totally, because it really is going to complicate and progress things too quickly in the wrong direction.
Dr. Pickett-Blakely, I'm going to bring you in here. We're talking about alcohol, and you are a gastroenterologist who also focuses on obesity medicine and the complications of obesity. And I know that you see a lot of patients who've had surgical procedures to address their obesity, and some of these patients are drinking. What are your thoughts about that?
Dr. Reed already alluded to the fact that alcohol is absorbed through the stomach, and there's different metabolic pathways or sort of different degrees of metabolism with respect to sex, but there are also differences with respect to the way your gastrointestinal anatomy is. So naturally, you have a stomach that's connected to the small intestine, but in the case of individuals who undergo weight loss surgery, for example, a gastric bypass, the normal anatomy is altered such that it alters your metabolism of certain nutrients. And we actually, it's been documented in studies that after weight loss surgery, there is a greater degree of alcohol misuse disorder after weight loss surgery. And the toxicity and the damage that you can see from alcohol can be heightened, especially in the post-weight loss surgery setting. So in individuals who have undergone weight loss surgery, they are counseled to avoid significant alcohol intake because of the alterations in the way that alcohol is metabolized after surgery.
So a lot of information for our viewers, and I bet many people didn't know that, because we do see a number of patients coming in after these surgeries who get in, whose livers get in trouble because of alcohol, and they really hadn't changed much about their intake from before surgery. So I appreciate you helping our viewers understand that.
Can I just mention one other thing with respect to alcohol? Regardless of whether you've had surgery or not, alcohol is considered an empty source of calories. So alcohol will give you lots of carbohydrates, lots of calories that in many instances is not going to serve you in a positive way metabolically. And so that's another reason why, especially if you're someone who's interested in losing weight, excess alcohol intake can be very counterproductive when it comes to weight loss.
So, Jasmine, I'm going to bring you in now from, your expertise. Lots of patients or lots of people, I should say, viewers are watching this and, they hear us and they're going to go to social settings where, they may want to have alcohol and there's a lot of peer pressure to drink. So what do you recommend for people who want to reduce or replace alcohol in their diet?
So that's a great question. And you're right. You'll be tempted to have an alcoholic beverage if you're surrounded by people who are also drinking. But there are ways to have fun without including alcohol. You can explore a variety of mocktails, right? So those are alcohol-free beverages. So some things that I could recommend are seltzers with added fruit or just lime. You can also explore options like tomato-based beverages or seltzers with ginger to kind of mimic some of the alcoholic beverages you may have been used to in the past. And then to add a little spice of fun, you can add things like fruits or vegetables to the mocktails, right? So maybe a little toothpick with some pickled okra and a tomato-based beverage to give you kind of like a Bloody Mary feel, or adding some olives to a seltzer could kind of give you a little bit of excitement so that you're not bored without having alcohol in your beverage.
I love that. So there's room for honesty and support, not shame. I think we'll take that message and see what we can do with that in our daily lives. Thanks so much. I want to move forward now and get back to the nutrition part of our conversation. And Jasmine, can you help us understand what a balanced, liver-friendly plate looks like?
Yeah, so if you see this visual, this is a visual of your standard 8 to 9 inch plate. And what I recommend upmost, the first thing I tell everyone is to fill half of your plate with non-starchy vegetables, right? Again, with this liver disease or this condition, you want to try to minimize the intake of starchy food. So non-starchy vegetables are going to be things like your leafy greens, your tomatoes, your mushrooms, broccoli, things like that. And sometimes it's easier to recall what starchy vegetables look like, right? Those are your peas, potatoes, your corn, your yams, foods like that. And whatever is not starchy is what you're filling half your plate with, right? Another part of your plate, about a quarter of your plate, you can fill with protein. So these are going to be lean protein sources, things like fish, right? Some chicken. They can be plant-based protein sources. So we have soy products, there's tofu. You can do beans, nuts, and seeds. Those can also count as some plant-based protein sources. And then the other quarter of your plate can be filled with whole grains, right? So these can be things like your brown rices, your grits, your oatmeals, right? These are going to be grains that are not refined or not highly processed, like Dr. Wilder was alluding to. So these are not the chips. These are not the potatoes, right? Not the pastas, and not the bread, right? You want to limit our intake of those, and instead replace them with whole grains.
And what are we crowding out of our diets?
Of course. So if you are filling your plate with these helpful foods, you will naturally be crowding out things like sugars, right? So this is, again, we want to avoid our intake of sugars and highly processed carbohydrates. We're going to be naturally crowding out our intake of saturated fats, right? Only the quarter of the plate is there for protein. So I know sometimes we can go to cookouts and, we're piling our plates with meat, right? That is not what we want to be doing here. So we're getting a lower intake of saturated fats, a lower intake of trans fats by avoiding those baked goods. We're going to also be crowding out alcohol by replacing our beverages with water, right? Water is going to be our first choice. If we can't, or if we're getting tired of water, we can do things like adding fruit to the water to add a little bit of flavor. And then also, naturally, we do want to focus on foods that are lower in sodium, and that's just for overall general health.
That sounds great. What about energy drinks? Where do you put those?
Yeah, so if you're eating a plate like this is naturally going to give you some energy. So there will not be a need to add those energy drinks in as a part of your healthy eating pattern.
Okay, so just the schematic looks very delicious. I can't wait to see what you're going to cook for us in your kitchen. Let's move on. We're going to do a little bit of a different structure now, a bit of myth busting. And this should be a quick round robin, true or false to our guests here. And these true or false statements come from statements that I hear or questions I get asked all the time, as a hepatologist in clinic. So brief explanations, please. We'll start with Dr. Reed. The first one is coffee is bad for the liver.
False. Coffee is not bad for the liver. In fact, it may be healthy for the liver if you avoid adding a lot of things like cream and sugar. So coffee, we don't know exactly why coffee may be healthy, but one of the substances in coffee, caffeine. But there are many other substances. There's over 200 substances in coffee, and some of them may be helpful in that they decrease the risk of scarring in the liver. They decrease the risk of liver cancer. And metabolically, it does not overload the liver in any way. So coffee is healthy. What I tell my patients is you don't have to drink it if you don't already drink it. But if you already drink coffee, try and take out the sweeteners and the cream. And really, you need sort of a moderate amount to have true liver benefit. If it's going to occur, probably 2 cups a day. And I don't tell anyone to drink a lot. Get those antioxidants, get the positive benefits of the coffee, but you don't want to get the jitters from drinking too much caffeine.
Awesome. Jasmine, artificial sweeteners are better than sugar.
Yeah, so I know I just said we're avoiding sugar. So there may be a tendency, if we're avoiding sugars, to go for the artificial sweeteners. But actually, the artificial sweeteners may contribute to liver damage, so they should also be avoided, right? Instead, we're focusing on healthy drinks, right? So we talked about the water, adding some fruit to water. We just said coffee is another beverage of choice that we can drink. Other things might be tea, right? We can do a herbal tea and leaning on the teas that are naturally sweet. So like a hibiscus tea could be an alternative so that you won't have to feel like you need to add sugar to it or any type of sweetness.
Fantastic. Dr. Wilder, you need to detox your liver with juice cleanses. I do get this one a lot.
Yeah, I get this so much. That's absolutely false. Number one, there is no data that, these juice cleanses or any of these strange concoctions people, get online are actually any good for your liver. Number one. Number two, the concern we always have as liver doctors is that these things that you're taking that are not truly vetted in the way your prescribed medications from your doctor are by like the FDA, that some of those medications and sort of, random supplements and things like that can actually hurt your liver. So I always tell my patients to actually stay away from those kinds of supplements and cleanses. If you are interested in eating and doing things to help your liver, then I would suggest you listen to everything Jasmine Burrows just said. She has provided great advice about the things that you can eat that will have a good impact with respect to your liver health. Dr. Reed touched on coffee, which is also very good for your liver health. And other things you can do include things like exercise, weight loss, and optimizing management of things like if you have high blood pressure, if you have high cholesterol, if you have diabetes. But these cleanses, absolutely false.
Well, I love that you touched on that because one of the questions that we got, and we're just going to read it, was to discuss the risk of, some of the dietary supplements, including, juice cleanses that are marked as being optimized for liver health. And so your message is that, you really try to avoid those things because they can actually do more harm than good. So thanks for that answer. Dr. Pickett Blakely, you can't improve fatty liver without losing weight.
So this is a bit of a trick question. Dr. Carr has thrown in a trick question for us. So in patients with MASLD, up to 50 to 90% of patients with MASLD are affected by excess body weight or overweight or obesity. So in those scenarios, it's better to lose weight to promote improvement in fatty liver. However, you can improve fatty liver through exercise, cardiovascular exercise, strength training, building muscle. Those have been proven to improve fatty liver. The other caveat to this trick question is that not all patients, I mentioned 50 to 90% of patients with mast cell may be affected with obesity. However, there is a subset of patients who are considered so-called lean mast cell. And so those individuals have a more lean body habitus or body size. And so in certain individuals, it is actually not appropriate to lose weight. There are also patients that Dr. Weiber mentioned on the spectrum of liver disease who have scarring in the liver or cirrhosis. And in extreme situations, patients actually do not have excess weight. They're actually malnourished or undernourished. And in those situations, it would be inappropriate to encourage weight loss. However, we would encourage healthy lifestyle. You can still focus on eating a healthy diet without the goal ultimately being for weight loss. And in fact, we also strive to take in a healthy diet and not have weight loss be the primary goal. So that was a trick. Dr. Carr thought she got us, but she did.
Fantastic. And Dr. Reed, just, in case the people in the back did not hear you the first time, if you drink occasionally, your liver is fine.
That is categorically false. Not only is alcohol a toxin, that if you have any underlying liver disease, even a small amount of alcohol can be harmful. And the safe amount, if there is such a thing, is a drink or less a day for women, less than 2 for men, and no binge drinking. And even then, there's always a risk of liver injury, especially if you have an underlying liver disease. So best to avoid it.
Okay, so let's see. These are all false. Thank you for that round robin. Appreciate it. Well, I promised our registrants that there would be a food demo, and some probably didn't understand how there could be all this great information and a food demo in an hour session. But we are going to make it happen. Jasmine is going to show us some of these tips in action. And, we often hear that people, one of the barriers to eating healthily is that there's no time in the day. Everybody's so busy juggling everything. But I think she's going to show us today that you probably do have time, and because we certainly are doing it in the course of this session. So Jasmine, what are you going to teach us today?
Yeah, so today I'm going to show you how to make a cowboy caviar, right? So we're very on brand with this year's theme of cowboy, cowgirl, and we have a cowboy caviar. It's also known as Texas caviar, but it's basically just a bean salad, right? There's a lot of recipes and variations to this recipe, so I'm going to show you how I make it, but while you're at home trying this out, feel free to add what you want to add to it so that it tastes really good to you, right? You're going to be the one eating it, so make sure you're going to enjoy it by adding things that you like. All right, so
okay. Before you go further, and while we enhance the screen so that our viewers can see what you're preparing, can I just do a little bit of a digression? When Jasmine said she was going to be making cowboy caviar, I was so excited because those of you who are my friends here know that I'm a huge Beyonce fan, and this is the year of the Cowboy Carter tour. And I thought, wow, the universe is just coming together. So I'm so excited to see what this dish is, and learn how to prepare it for my own family.
All right, so what I want to do is, if you remember from the previous slide about the healthy plate, right, there were 3 big components on that plate. Right. One was the non-starchy vegetables. So here in this recipe, we have some non-starchy vegetables. We've got bell peppers here, right? And I've included an array of colorful bell peppers. And you want to really focus on colors on your plate. Try to add, at least 2 to 3 different colors when you are thinking about making a meal, so that you're getting a lot of antioxidants and phytonutrients from your foods. Again, these are little molecules and chemicals that can support your liver. So we've got some multicolored bell peppers here. I've got green, orange, and red. Then I've got some celery, right? If you want to add celery, you can definitely add celery. And then I have some red onion. And the reason I chose red onion, right? So red onion, or all onions, really have this compound called quercetin, which is a natural antioxidant. It's a really powerful antioxidant, and it's going to be in your red food. So red onions have a higher concentration of the quercetin versus the other types of onion. So if you want a white onion, you can use it, but I'm choosing red. It's going to add a little bit more of a bold flavor as well. And then we also have some pico and some cilantro. So I like my like a more of a Latin flair to my food. So I'm adding this. You may not find this in the recipes that you look up online. But again, we're adding more colors to our plate, which means more nutrition. Okay, so those are the non-starchy vegetables, okay? Another part of that plate, a quarter of that plate, was your protein. So here we have some black beans, or black-eyed peas, sorry, black-eyed peas. Black-eyed peas are going to be a plant-based source of protein. And on that plate was a quarter of your starchy food. So they're also a starchy food. So they're accounting kind of in both of those categories. We got a protein and a starch, right? And I'm using black-eyed peas. You can also use black beans if you want to, but I'm using black-eyed peas because I'm familiar with black-eyed peas and I like black-eyed peas. All right. Another thing with the beans and these non-starchy vegetables, they are including a lot of fiber. They're natural sources of fiber. And fiber is again, another compound that is going to really support your liver health. So you want to make sure when you're eating, you're trying to get a good amount of fiber in your diet. It's recommended for us to get at least 25 grams of fiber on the low end. On the high end, more like 38 grams a day of fiber. So definitely incorporate your fruits, your vegetables, your whole grains, your beans, nuts, and seeds to get plenty of fiber throughout your meals. All right. So what we want to do is we're going to start by making the sauce or the dressing for this salad. So here I have some olive oil, right? So olive oil is part of a healthy eating pattern. It's a healthy fat. And this is kind of associated with the Mediterranean diet, which again is a very helpful eating pattern. So we're going to add some olive oil to our dish. Okay, we got some apple cider vinegar. A lot of you will probably have this in your pantry. We got some apple cider vinegar here. This is going to add a little tang. Right, and this is also a good compound that also supports liver health. Okay. Then let's add some herbs and seasonings because we want to make sure that we have flavor in our meals. Here I'm going to add some Dijon mustard. You can add as much or as little as you'd like. I'm just going to add a little squirt there.
I hear from people a lot that, healthy eating doesn't taste good. So you're telling us you can make it taste good.
Absolutely, absolutely. I don't believe in eating bland food. I don't want you to feel like you're a rabbit eating grass. All right, we're going to add flavor to all of our meals. Okay, so here the flavor is coming from the Dijon mustard, the apple cider vinegar. The vinegar is also something that you can add to foods in order to cut out the salt. Remember, I said we want to naturally reduce the amount of sodium that we're eating over the course of our meals. So one way to not have to add salt is to add an acid like vinegar. All right, but now to our seasoning. So seasonings make everything taste good. So here I have some garlic powder. If you wanted to, you can add fresh garlic, right? Garlic is another food that is really, really good for liver health, okay? I don't have fresh garlic, so I'm adding garlic pepper. It's important to use what you have access to. So if you don't have access to the fresh garlic, you can add garlic powder. If you don't have access to fresh onion, you can use onion powder. Okay, we're also going to add some herbs. So again, may not have access to fresh herbs. You can always use dried herbs for cooking. So this is Italian seasoning. It's just a blend of oregano, thyme, some rosemary, sage. So that's going to add some good flavor here. Again, seasonings and herbs, you may not know, but these little things are other ways to add some more antioxidants and phytonutrients to your meal. So don't sleep on the seasonings. All right, so we got that. We're going to give this a little stir. And this is going to be our marinade. And something I also recommend is while you're cooking, make sure you taste to make sure it tastes good, right? So that's going to be our dressing.
Does it taste
Yes.
good?
It tastes good. It tastes good, yes. And if it doesn't, you can just adjust it by adding more seasonings or more of the mustard as you prefer. But now I'm going to add my black beans to our bowl. Okay, black beans full of fiber. I do want to make a note that if you didn't want to add black beans, you wanted to use another bean, Did I say black eyed peas? Black eyed peas. All right. You can also use black beans. So black beans and garbanzo beans or chickpeas are two types of beans that actually have more fiber than the black eyed peas. So these are considered good sources of fiber because if you look on the label, you'll notice that for the black beans, they contain per half cup 6 grams of fiber, which is 21% of your daily value of fiber. Because it contains more than 20% of your daily value of fiber, it is considered a good source of fiber. So black beans are going to be a good, inexpensive option. And then also these chickpeas, if you look on the label, these also contain 6 grams of fiber per half cup. So again, a good source of fiber. All right. And that's just if you like those, right? But again, I like black eyed peas, so that's what I'm using.
Not everyone likes black eyed peas.
Right.
You know,
Yeah.
I
So we
love
got
black
options.
eyed peas.
I love them too. I love them too, Dr. Wilder.
Can you comment on, the fact that you're using canned beans versus cooking them fresh? Does that in any way change the flavor?
So I wouldn't say that it changes the flavor, but it does cut down on the prep time. Okay, so if you do not have time to be in the kitchen all day, of course you can soak beans overnight and then kind of slow cook them to get some of those gassy producing compounds to be released. But if you don't want to do all that, grab you a can of beans. These are still low priced. They haven't risen in price like all these other foods. The only tip is to reduce the sodium because these are going to have a little sodium in them. To reduce the sodium, once you use the canned beans, you rinse them off before you actually add them to your meals. Okay. But I love recommending canned beans for those who want minimal prep. All right, so I added the bell peppers, I'm adding the celery, and then I'm adding some red onion. All right. And we've got our dressing that we're just gonna pour on top. Wow. Okay. This is really simple, really simple. And all we're gonna do is give this a stir. And this is good to eat today, but really you can just eat a little bit today, put it in the fridge. Once you let it marinate, all the flavors get to soak together and it comes out even better the next day. So for those of you who do not like leftovers, this is one meal that you do want to eat the leftovers.
It looks
all right.
Beautiful.
So if you look, you see all these colors in the meal. Look at all those colors.
Wow.
That's what we're aiming for, is a very colorful dish. That's kind of a note to know that this is going to be very healthy and helpful for your liver. All right. And I wish you could smell it. It smells so good.
Tell
you
us,
can eat this.
Describe, what does it smell like?
It smells savory. I'm smelling the herbs. I'm smelling a little tang from the vinegar as well.
Another thing that you have,
you want to take a bite.
Another thing that I just want to comment that you have going on here is texture. And so we know a lot of, your digestion starts before you even put the first bite of food in your mouth. And so you alluded to the smell. And then once the first bite hits your mouth, you have the crunch of the celery, you have the softness of the beans, you have the crunch from the peppers. And all of that helps to send signals to your brain as well to say, okay, I'm doing a lot of work here with digestion. So it helps to control portions as well when you're eating.
Absolutely, absolutely. And on that note, that is something that is recommended. Before you eat, try to smell and engage with your food. As I was smelling the food, I could notice that my mouth was already starting to salivate. So my body is actually preparing to digest the food as I'm just smelling it.
So Dr. Pickett, metabolically, what, and with these ingredients, anything stand out to you?
This dish is power packed with all of the things that we need. So Jasmine did a nice rundown, but I'll just add a couple of things. The fiber content is fantastic with this dish. There's another, so we think about foods that we eat, and then we also think about the additional things that are added to the foods. So there's this non-nutrient additions to food called ABGH, or advanced glycolated end products. And these are associated with highly processed foods that are cooked, smoked, cooked at high heats, ultra processed foods. And you can have high contents of these essentially toxic agents in lots of foods, processed foods. But the good thing about this meal is that you can, with cooking at high heat and smoking, you encourage the formation of these toxins. But you notice the ingredients that Jasmine is using are pretty much whole foods, very fresh, and didn't require heating at high heat. The other best kept secret of apple cider vinegar, and even with lemon juice, you can reduce the formation of these toxins by adding an acidic nutrient such as lemon juice or with apple cider vinegar. So you're also getting additional bang for your buck there. The Dijon mustard, the yellow color, part of the yellow color, comes from a derivative of curcumin or turmeric, which we know has anti-inflammatory properties. So one thing about foods and eating whole foods is that you get all these additional benefits that you don't even recognize that you're getting, versus taking apple cider vinegar in a pill or taking a multivitamin supplement in a pill. When you eat it in a food form, you're getting all of it together, and some things that you don't even realize that you're getting that are beneficial. So I think this meal is packed with vitamin C, all the colors vitamin C, B vitamins, fiber, protein. It's got all the things that are good for your liver.
Wow. It looks amazing. I didn't even know all of those added benefits, Dr. Pickett-Blakely. I'm so glad you're here to help us. Jasmine, why don't you show us that dish again?
Yes. So here's the final product.
Nice.
And again, if you wanted to add a little spice or something nice, you can add, a little bit of, I got pico here, which is basically just tomatoes, some cilantro, and this is a fresh herb that's still low priced.
Is that a lime?
Yep, and then lime. Yep. Sometimes what I recommend to folks before they add salt or think to add salt is to give you just a touch of lime juice. Again, it heightens that acidic or the acidity of the food, and it kind of gives the effect of salt without adding the salt.
That's a great tip. Pro tip right there. Thank you so much, Jasmine. That looks amazing. Cowboy caviar. Appreciate that. We're going to go back to just some of the questions that we got from folks who registered to make sure I can get to just some of those. We can't get to all of them today, but we'll do our best to answer a few. Dr. Pickett-Blakely, one of the questions that came up was about intermittent fasting. Is that helpful for the liver?
So time-restricted feeding, intermittent fasting, these are all categories of modifying food intake behavior. So there's been a lot of conversation around the utility of intermittent fasting. The long and short of it is that when you look at the studies, they're sort of all over the place. There are some studies that show that intermittent fasting can be beneficial, especially when it comes to controlling your blood sugar, reducing your blood pressure, all the what we call metabolic effects. When it comes specifically to looking at the liver, we don't have studies that show that intermittent fasting is definitely beneficial in humans. However, there are some studies that were done in little mice that showed that when you expose the mice to intermittent fasting, so in a 7-day week, the mice had regular feeding patterns 5 days, and then they fasted for 2 days. These mice actually had lower levels of something called the AST, which is one of the liver enzymes that we measure in the blood. The mice also had improved blood sugars. They had a reduction in the total amount of fat in the liver, and actually they lost some weight. So in general, if it's something that is feasible and can be done in a healthy way, I generally do recommend time-restricted eating for a finite period of time, and then allowing your pancreas to rest, allowing your digestive system to rest over some hours during the day. So an example of intermittent fasting would be, like I mentioned before, 5 days of eating and 2 days of fasting. And fasting would mean no significant calorie intake. So that would be drinking water, drinking coffee with no added cream or sugar, etc. But time-restricted eating would be, let's say you eat from 11 a.m. to 8 p.m. and then the other hours, so from 8 p.m. to 11 a.m., you fast during that period of time. And that allows your pancreas to get a rest. That allows your body sort of to re-equilibrate. What it does not mean is to eat ultra-processed foods, processed foods, lots of salt, lots of sugar, drink all the alcohol that you want in those hours. So you sort of negate the positive effects that you would have when you do that. So if you have a healthy diet, for example, with some cowboy caviar in it during your eating window, and then your fasting window, you're taking in water or truly fasting, then it can certainly be beneficial.
Dr. Pickett Blakely says, let me be clear, do not misunderstand.
Right. Right.
That's awesome. Jasmine, we didn't get a chance to talk about snacks. You know, the days are long, people are working, you know, many hours and get hungry during the day. So what's a good snack if you have extra fat in the liver?
Yeah. So again, we want to emphasize a lot of those non-starchy veggies. So if you can include a snack that has non-starchy veggies, so for instance, maybe some veggies and a dip. You can dip it in some avocado for some healthy fats. You can dip some veggies in hummus, right? So that's another dish that goes along with that Mediterranean theme, where the Mediterranean eating pattern is more so recommended for liver health. You can also incorporate some nuts and seeds, right? So those are, again, plant-based protein options that have healthy fats to support your liver. And then you can maybe pair those nuts and seeds with a piece of fruit. Again, you can get some natural sweetness without the added sugar there.
Fantastic. Dr. Reed, we covered this a little bit, but can you crystallize it for us? Do supplements help reverse liver damage?
No, supplements do not help to reverse liver damage. In fact, many of the supplements that you will find in the stores, if you read the fine print, they say this does not treat or cure, reverse any disease. And they mean it. They have not been tested. They're not approved by the FDA or any other agency as a medication. They do not reverse liver disease. And in fact, as Dr. Wilder said earlier, they can be harmful. So one of the things that we recommend for our patients with underlying liver disease is do not take supplements.
Yes, and if you are thinking about it, please do talk with your healthcare provider before taking anything, especially if you have liver disease. Now, Dr. Wilder, this is, I think, a really great question that came in because while we're mostly focusing on adults in the conversation today, with the conversation about alcohol, for example, kids can get mazzled. You talked about mazzled earlier, and one of the questions was if someone is told that they have extra fat in the liver or have mazzled, could their kids get it, and should therefore their kids be on the same liver healthy diet?
Yeah, that's actually a really important question. And it gets to a number of really important issues about how we live and how we eat as a family. So first of all, kids absolutely can get massed. 1 in 10 massed. And if you look among kids who are obese, up to 30 to 40% of those children will have massed. And they can have the same complications where the disease can progress and it can lead to significant liver damage. And a lot of the same factors come into play in terms of kids who have massed. The same complications can occur. And there actually is a genetic link too. We know, we're learning more about the genetics around massed and how that may come into play if you have it and you have children as well. And so can your kids get it? Absolutely. And should they be on the same diet? Well, the thing is they already are on the same diet as you because they're living with you and they're seeing how you eat. And so the important thing is to make sure that you and your entire family are adapting, really lifestyle changes that are healthy overall. So eating a healthy diet, as Jasmine has described tonight, is a great way for you and your children and your entire family to live a longer, healthier life and protect you from having fatty liver disease, as well as incorporating a lot of exercise and activity into your kids. We got to be careful about talking too much about diet per se and saying the word diet and weight loss to children, because there are a lot of issues we can run into with body, image issues and identity and those kinds of things. And so it's important that we're careful about not pushing that per se, but really focusing on the health and the importance of living healthy and doing healthy things.
All great answers. And I wish we could get to all of the questions, but we just have about one more minute. And I want to just hear, what the panelists have to say for their final takeaways. Dr. Reed, maybe 1 to 2 small steps that patients can use to shift their habits.
Yeah, the habit shifting is the most important thing that we recommend in our patients with fatty liver disease, and one of the easiest for us to say. I know it may be not easy to do if you grew up drinking a lot of sugary beverages, but or just have adopted that as an adult, is to stop drinking the sugary beverages and replace those, as Jasmine said earlier, with water. Add the lemon, lime, fruit, whatever, but avoiding sugar in your drinks. It's so easy to consume lots of calories through a drink. And that includes things that you might think of as healthy drinks, is to really limit yourself to liquids that do not have calories like water. I really think that's one really good thing. I love the divided plate, and what I tell my patients to do, this is not super hard to do because canned vegetables and other things can be used, is sometimes to use multiple colors on your plate. When you plate your vegetables, plate the vegetables first. And I tell my patients, often they are happier if they have 2 different vegetables of 2 different colors. So that's something that they can do to make it more appealing, add those herbs and other things, as Jasmine suggested, and then take a walk after dinner.
Awesome. Jasmine, what about grocery shopping? We didn't get to see that part of your prep today. What's your advice?
Absolutely. So, well, first, I want to recommend focusing on whole, minimally processed foods that you do have access to. So when you go to the grocery store, spending time in that produce section, trying to look for the foods that you do enjoy, pick those up. Try to pick at least 1 or 2 new foods a week that you can try, so that you can start to incorporate a larger variety of produce or of fruits and vegetables, again, to improve your gut health. Then also focusing on, if you do want to cut down on the time spent in the kitchen, try to plan your meals, right? And go to the grocery store with a shopping list. Try to shop in those aisles that do have things like your nuts, your seeds, your whole grains. Those are going to be found in those inner aisles. And then shopping the perimeter for a lot of your other whole natural foods.
Fantastic. Dr. Wilder, I bet this session, even though we tried to keep it as simple as possible, is also overwhelming to people who are watching and certainly our patients. In a couple of words, what can you say to your overwhelmed patients?
Yeah, I mean, it's a lot to navigate and process, and making changes to how you eat and how you live can be very, very difficult. But the liver is resilient, and small changes in diet can really yield big results. And honestly, we're more likely to make small changes at a time as we try to get better and better at the way we eat, the way we exercise, the way we do anything. And so don't become overwhelmed. Know your liver is resilient, and begin by making small changes in your diet that are sort of low-hanging fruit that you're able to do. And then build on that as you move forward.
Great. Dr. Pickett-Blakely, you get the last word here. What's your takeaway?
Well, I think Dr. Reed, Dr. Wilder, Jasmine all took my thunder, so I'm having to come up with something original now. But what I will say is that your life and your health is a marathon and not a sprint. And it's important that these small incremental changes, that you view them as not a one and done, or that you have this short-term goal, I'm going to get there and it's going to be over. You want to think about changes that you can sustain throughout the course of your life. And the 3 biggest predictors of success when it comes to lifestyle modification, particularly when it comes to food, is number 1, reducing the overall energy that you take in. Number 2, sustainability. So there's no point in me telling you to do a diet with a bunch of foods that you don't like or that you don't tolerate. So whatever diet you can stick to, or whatever lifestyle modifications you can stick to, are what are for you. And then the third thing is high quality. If you look at the food and you're not sure where it originated from, then chances are it's not going to be good for you. If it's cooked up in a lab somewhere, it's probably not good for you. You should stick to the things that come from the ground, that grow from the trees, that you recognize where it originates from. And those are the best steps to move toward health.
All right. I certainly have nothing more to add. I just want to say a big thank you again to our guests. And I hope this segment convinced all of you watching that caring for your liver is pretty simple. there are many steps here that you can try. Keep it simple. Just start with something. Ask questions. Engage your family and your community in what you're starting as well. This recording will be available on our website and social media. Follow us for future sessions on practical liver health strategies. Thank you for joining us.